honestly, I think hospitals need a menu. Um, you know, you go in knowing this is how much this costs. There's these big companies, they're operating almost on like a strictly profit scale. I think you would see America net benefit from all medical hospitals, all that being non for profit. I think you would see not only the quality of healthcare go up, but then your medical advancement.
Well, I think one of the things that you said very nicely, right? Like capping a salary and not giving the CEOs bonuses and increasing premiums or doing what I would imagine would be the healthcare equivalent of shrinkflation, where they change policies or take away policies that are affordable and help people get quality care from smaller employers that don't have over a certain number of employees. So, or even in the negotiations with hospitals and other in-network services about reimbursement, not going in and lowballing and saying, "Oh, we're going to give you a 5% decrease in what we reimburse this year just because we lost money last year." It makes no sense to give a decrease in reimbursement when everything is more expensive than ever, and quality healthcare needs to also be considered as a not a luxury but a basic human right where, hey, this is what I need to survive and sustain.
We actually have, of all developed countries, we have the lowest life expectancy. We have the lowest performance on a variety of health outcomes like heart disease, obesity, mental health issues. Like there's a plethora of things that come into into play, and the number one issue that at least Harvard Health attributes to that is high administrative costs. What do administrative costs qualify for? So it just goes to kind of hammer home in the system that, or that as we've discussed, that there's just so many broken aspects to the system. Now, I like the idea of having non-for-profit healthcare institutions, um, but I
Mhm.
think that leads to the current state of political gridlock because one of the main issues that people were coming to. We think about Obamacare when it was